Okay, this is part 3 of a myofascial release evaluation video series that we're doing here at Oakworks today. I'm Walt Fritz. I'm the director of the Foundations and Myofascial Release Seminars. In the first 2 videos, we did a standing, seated, supine, and prone evaluation on Molly. Molly's chief complaint is left knee pain. Now, when we did the second video, we saw that her right quad had a fair amount of tightness. I really didn't assess the left quad at all, but when we flipped her over and I checked the range of motion, she certainly had pain at that very gentle end range. Other things that we found, she did have a bit of a pelvic asymmetry. Now, the pelvic asymmetry may or may not be germane when it comes to treating that knee pain. The way I treat, it would probably be, I would probably spend the good part of the first session treating where she's having the pain. That's the area of the knee, the area of the quadricep, that sort of thing. At a later date, I may want to step back and say, okay, what are we missing here, if we're missing something, right? That pelvic asymmetry may be creating some issues with internal or external rotation of the femurs, creating differing strains on the quadriceps, that sort of thing. But to start with, we're just going to do some treatment right to her thigh. So Molly, if I could have you lie head up here, please. And I am just going to repeat, come over toward me, just a hair. That's good. I am going to repeat what we did on her other leg, and I'm going to do a little deeper palpation. Oh boy, it didn't take much to find that hot dog or that rope right in there. And again, those are areas that really shouldn't be so tight, shouldn't be so gristly or dense. What do you feel up in here? No?
Nothing.
Okay.
Good.
So kneecap was a little tight, and I think camera can probably pick up some of the scar tissue. Got a fair amount of scar tissue above, below, on the outside. So in terms of treatment, these are some of the very basic myofascial release techniques that you're taught would really be very helpful for Molly. Cross-handed release right on the skin to the quadricep. And I have so many options in terms of pressure. I could stay very, very light, just engage the very subtle barriers. And this should be fairly comfortable for Molly, not a lot of, yeah. With the tightness that I feel here, as well as the extensive injury and scarring, I can predict I'm going to spend a fair amount of time releasing this area. There are times when we get into that dense, ropey feeling where we need to go in a tad more aggressively. Now, my previous visit at Oakworks, I did a technique where we did the myomobilization for the hip and thigh like this, where we went in very deeply. You could certainly work with those principles, the myomobilization, which is nothing more than adding a bit of deeper pressure to myofascial release. I was taught when I feel this tightness, when I feel this leatheriness, that I need to come in and do a pin and stretch. Now, I'm not going to do this because it hurts you and me. But a lot of therapists still do this work where they'll hold up here, they'll bear down as hard as they can and stretch deeply all the way down, making multiple passes, leaving red marks, bruises, the whole thing. Yeah, it works, but it's also tough on the patient and it's tough on me as the therapist. I've found by just adapting those principles and just applying a little bit more pressure and engage that deeper barrier, she may feel a bit of discomfort, but it should always be completely tolerable. How does that feel? You can feel that I'm in there deeper though, right? But yes. It's not too much in any way?
Not at all.
Okay. So spending time both more of a superficial light stretch and a deeper one. Getting in here, doing some very focused patellar releases. Up, the lower part of the patella. We may want to actually come in and try and lift the patella up in the air. She's got some scar tissue in here. We may want to do a little cross-handed release or single finger technique in that scar region there. Anything to free this up. What I typically do after I spend the bulk of a session working on the thigh like that is, if you wouldn't mind flipping over on your back, on your stomach, please. Now, the left knee is the knee that we were working on, but for the sake of the camera, I'm going to do this leg. After I spend a lot of time doing the deeper type of release, the myofascial release to the quad, the kneecap, I want to provide some actual elongation here. So what I'll typically do is, just like in the assessment phase, I'm going to engage very gently that barrier, and then I'm going to patiently wait. I may want to rotate a little bit to see if I can reproduce some of her familiar symptoms, or I may notice that we're getting specific tightness when I go in a certain range. I can also come under her lower thigh with my hand I'm both lifting slightly to the ceiling. I'm also tractioning down toward her feet and then engage that barrier. Adds a wonderful three-dimensional component to the whole piece. All right? So I'd probably spend 5 or 6 minutes just slowly stretching. While I'm doing this, I'm engaging Molly in the process. I want her to know how little pressure we really need to use because I'm going to give her homework. Most of the time when our patients stretch, they're going into a lot more aggressive stretch where they're pulling like this. They may do it in the traditional way of standing, bringing the leg up like this. But what I'm going to do is ask her to buy or borrow a yoga strap or something similar, some sort of a non-flexible strap. If it gives, it doesn't work. A belt could work, that sort of thing. We hook the strap around here, and the strap goes over her shoulder, and Molly would just grab hold of the strap like this and gently pull. On my website, there is a page where it says Archives, and this is one of the many home stretches which I've made available to therapists around the country to use with their patients. And fabulous stretch for knee pain, quadriceps tightness, and for low back. So the sum of our assessment, both in standing, supine, prone, and sitting, was that we found a tremendous amount of tightness in Molly's quadriceps. She was complaining of left quad pain. We addressed it through some very specific myofascial release techniques, as well as teaching Molly a home stretch that she can use not only to maintain what we did today, but hopefully to take herself further. I appreciate you spending time with me. If you need any more information, please refer to my website, www.foundationsandmfr.com.